So here you are seeing is an image of both the joints at the two ends of the clavicle. Medially, you have this joint called sternoclavicular joint. And on the lateral end, you find is another joint called acromioclavicular joint. This joint is a peculiar joint as it has some peculiar features. One thing is about the variety. So this is a plain variety synovial joint. Both these joints, they have their intra-articular disc, and that's why this also is a complex joint. But the important point here is that this intra-articular disc here in this joint is perforated. So the joint cavity is not separated out, unlike the sternoclavicular joint. Another important fact about this is, which is a peculiar thing about this joint, because as you know, synovial joints have three criteria to be fulfilled. One thing is that the articular surfaces should be lined by a hyaline cartilage, which is devoid of perichondrium, and that's called articular cartilage. Second thing is that the joint space should be covered from all the sides by a fibrous capsule. And the third thing is the cavity of the joint has a lubricating fluid covered by a membrane, and that's called synovial fluid. So these three criteria for a joint to be called a synovial joint. But here, important point is that this acromioclavicular joint, this articular surfaces, both the sides, this is not a hyaline cartilage. This is made up of fibrocartilage. These are important points to remember about the acromioclavicular joint.